Welcome, Namaste, and welcome to Dr. Shah's Clinic. It's been quite some time since I posted my last video. In this quick video, we are going to discuss about what to do if you're unable to ejaculate or delayed ejaculation more specifically. Now, delayed ejaculation is also called as inhibited ejaculation. Now, in this particular condition, men are unable to ejaculate after penetrating the vagina of their partners during penetrative partner sexual intercourse. Now, the average ejaculatory latency time, that is the time to ejaculation after penetration, is about 4 minutes to 10 minutes. Basically, in individuals who have delayed ejaculation, this time goes to 20 to 25 minutes, and in some cases, as delayed as 45 minutes to even an hour. Now, in these scenarios, what basically happens is that the male partner is very distressed, he's very upset, and he basically suffers, and the female partner or his lover or his wife or girlfriend, whatever be it, also faces similar sense of distress, difficulty, and there's a general lack of sexual satisfaction. Now, the female partner of such men who have delayed ejaculation frequently find themselves with poor self-esteem issues. They have difficulty with their own body image, and a lot of psychological problems, and they probably think that they are not attractive to their partners, and that's why he's unable to ejaculate into her. And a range of problems can happen, including problems which are not linked to sexual issues. Fertility issues are also commonly seen in men who have delayed ejaculation, because if the semen doesn't deposit into the vagina, how is a child going to be born? So that's fertility problems are also very common in men with delayed ejaculation. Now, it's usually, this particular problem is usually seen anywhere from about 4% to about 8% of men with sexual health issues. And one thing that we have consistently noted, in my clinical practice and experience as well, and also in the published literature which is available, is that a large proportion of these men with delayed ejaculation usually have masturbatory behavior. People with masturbatory behavior are auto-sexually oriented, and basically what this means is that they have to take their hand to their organ in order to feel that desire come into their system. So the partner's vagina may not be adequate to give them the stimulation that is required. So they have to take their hand, use the thrusting force of their hand to get their ejaculation. And men with delayed ejaculation frequently have masturbatory behavior, which is an autosexual orientation, or sometimes an idiosyncratic masturbatory style, which means they frequently resort to something called as prone masturbation. Now, I've linked up to a video on the right hand side, right upper corner side of my screen. It will be there sometime, right hand side corner of the screen. There's a separate video on prone masturbation, and definitely do look at that as well. So individuals with prone masturbation frequently rub their organ on the bed, and that's what gives them a high, and they they get good desire when they do that, and then eventually they get ejaculation. Apart from this, there are certain other causes of delayed ejaculation that has been reported and that we have seen in our clinical practice. Are conditions that, like, the patient might have had a major abdominal surgery. He may have elevated prolactin levels. He may have very low testosterone levels. Apart from the masturbation issues, then the patient may have a spinal cord injury. Sometimes the patient may have issues in the male reproductive system itself. A Mullerian cyst or utricle, or certain abnormal congenital structures that are present in the male reproductive tract will inhibit the ejaculation. Sometimes the patient may also have genitourinary tract infections from sexually transmitted diseases. So there'll be a burning sensation during ejaculation, and because of the burning sensation, consecutively the patient will develop what's called as a delayed ejaculation. So he will not treat the primary issue, but eventually he will end up with delayed ejaculation. So genitourinary infections can also lead to delayed ejaculation. Majority of the time, however, delayed ejaculation is largely psychological. So what can you do, if you are unable to ejaculate or you suffer from a typical condition of delayed ejaculation? The best thing to do is, of course, to visit a sexologist or an andrologist, get a thorough clinical history, get a thorough psychological evaluation, thorough psychosexual history. In some individuals, we have also seen the men are sometimes conflicted with their sexual orientation. So they'll be in a heterosexual relationship, but probably they have a more homosexual orientation, or they may be bisexual but with a more divergence towards the homosexual orientation, and because of that sexual conflict in their system, they're now going to be able to ejaculate with their current partner who's a female, because there's an issue with the orientation, or the orientation is unresolved. So it's important to visit an andrologist or a sexologist who has a good grounding in both sexual health as well as fertility, and sort out the problems. And analysis of your male sex hormones can also help, because we can identify issues with thyroid, prolactin, testosterone, and other things, right? So That's how the workup happens. And what do you do when you have delayed ejaculation? What are the treatment options? Basically, it depends on the cause, right? So if it's a psychological cause, we are going to give cognitive behavioral therapy. We are going to give psychosexual therapy. Sometimes we'll also give an REBT therapy. It really depends on what's the cause. And we give visualization exercises, and we take them through a whole series of CBTs and REBT and sessions, about 4-5 sessions if it's psychological, and we try to resolve their conflict. But however, say it's not psychological and there's an organic problem, right? There's something wrong with the individual's hormones. What we can do there instead is basically, treat the problem that's there with the hormones. If the prolactin is high, we reduce the prolactin. Testosterone supplementation is required, especially in hypogonadotrophic hypogonadism. There we can give testosterone supplementation, and really depends on the cause of the organic issue. And the last treatment, what we probably do with our patients is we help them achieve antegrade ejaculation. So some medications which have been used and which we have also used for the treatment of delayed ejaculation includes cabergoline. Cabergoline is given 0.5 milligram twice a week for about 4 to 8 weeks. It triggers antegrade ejaculation. Mind you, cabergoline has side effects, so do not self-prescribe. Please visit your doctor, visit your nearby andrologist or sexologist near you if you have delayed ejaculation, and only then take the medication. And some other drugs that have been used and reported in the literature include midodrine hydrochloride. We have personal experience with using midodrine hydrochloride, ephedrine, pseudoephedrine, and few other drugs are there which can be used to treat the delayed ejaculation problem. So I hope you found this video reasonably informative. It is a very broad topic to discuss on, but the take-home points that we have to bear in mind is that delayed ejaculation means patient is unable to ejaculate, patient is unable to achieve ejaculation even 25 to 30 minutes after penetration. Second, it is a treatable condition. Number 3, a thorough psychological evaluation, psychosexual evaluation, and medical evaluation is definitely required before treating the patient. Lastly, there are drugs which can be used, and commonly used drugs include midodrine hydrochloride as well as cabergoline, which are commonly used clinically for the treatment of delayed ejaculation. Hope you like this video. Please like, comment, and subscribe. I'll be making many more videos in next coming days, and please share this video with your friends. And if you know anyone with delayed ejaculation, do share the video. I'll see you soon again. This is Dr. Shah. Vanakkam.